Hello, my name is Dr. Greg Symko, and I'm here to talk about why my pain keeps coming back. Whatever pain you may have, whether it be back pain, leg pain, headaches, neck pain, you see the therapist, whoever it may be, it feels good for a while, and it comes back again. Now, why? Well, what I've discovered, and what many physicians and clinicians have discovered, is that it may not have to necessarily do with the site of the pain. It may not have to do with your back or your neck or your shoulder or your elbow. Now, granted, there may be tissue damage in those areas, and that needs to be addressed. But what also needs to be addressed is how or how those areas are being controlled. Now, what research has shown is that there's parts of the brain that controls parts of your body, very specific parts of the brain that controls very specific parts of your body. In other words, there's a part of your brain that controls elbow movement. There's a part of the brain that controls finger movement. There's part of the brain that controls hip, neck movement, eye movement, okay? Also shoulder, knee, toes. And those parts of the brain need to work properly in order for your joints, finger, elbow, shoulder, knees, toes, to work properly. So in other words, if a part of your brain, and let's talk about a very specific part that's found in the cerebellum, which is in the back of your head at the base of your brain, and a part of the cerebellum which is called the intermediate part, and in the intermediate part of the cerebellum is something called the globus noboliform nucleus. Now, the globus noboliform nucleus is found in the intermediate part of the cerebellum, and there are two. There's a right and then there's a left. Now, the right and the left control what? They control the shoulders, the elbows, the hips, and the knees. Okay? They make sure that your shoulder moves properly, that all the muscles contract at the correct time. They make sure the elbow moves properly and all the muscles contract at the right time. Same with the hip and the knee. Now, I'm sure all of you heard that, well, there could be arthritis in the shoulder, the knee, you have hip replacement, knee replacement, what have you. Some people have knee replacements and hip replacements and are still in pain. Some do very well. Some people suffer a long time with hip pain or knee pain or elbow pain or shoulder pain for really no significant reason that can be seen on an X-ray or an MRI. Sometimes they have surgery, they snip here, snip there, they get injections in the knee, but no one ever looks at that part of the brain called the globus noboliform to see if it's actually working okay. So can you imagine if a wheel on your car is not placed or put on properly? It wobbles. Well, that's kind of the same thing that happens if your brain or that part of the brain is not controlling your joint. It kind of wobbles a little bit or it doesn't work quite well. Now, if it's not, if say for instance you're moving your shoulder back and forth for whatever reason, using a computer, playing tennis, throwing a baseball, and that part of the brain that helps coordinate and run that shoulder is not working very well, what do you think is going to happen to that shoulder? It's going to wear out a little bit. It might have arthritis. It might produce pain. So then you go and work on that shoulder, massage it, put therapy on it, do all those kinds of things, but you never take care of the part of the brain that runs it. So it feels good, but then you use it again and it comes back. So do you see what I'm saying? So what you need to do is find someone that can look at that part of the brain and find out if it actually is controlling your shoulder, your hip, your knee, or your elbow, or any part of the brain, because there's a part that controls the fingers, there's a part that controls your toes, there's a part that controls your ankles, your neck, and your low back. Okay? So my suggestion is if you have chronic pain and it keeps coming back, there may be more than just the joint. It may actually be part of your head and in your brain that's running things. And you know what? It's actually very easy to figure out if you have a problem in those areas. And it actually is not too difficult to take care of them. Thank you, and have a great day.